Hello, Lake Providence church family and friends. Good morning. Thank you for joining the LPMBC Health Ministry for another health update. This is Dr. Linda Plummer Ward. Well, Nashville has moved to a modified phase 3. It continues with the requirement to wear masks or face covers when away from our homes. Social distancing is also strongly urged. We will refer you to asafenashville.org/roadmap for more details of the Phase 3 reopening plan for Nashville. Those over 65 with high risk, such as chronic lung disease, moderate to severe asthma, serious heart conditions, people with compromised immune systems due to cancer treatment, smoking, bone marrow or organ transplant, genetic or acquired immune deficiencies, or the prolonged use of steroids should remain safer at home as much as possible. However, if you have a medical problem that you feel needs attention, do not hesitate to call your doctor or go to the nearest emergency department. If you haven't been out much, what can you expect right now? Expect screening questions and or temperature taking in many places of business before entrance is allowed. Most places of business will have signage requiring masks to be worn. Look for the 6 feet distancing on the floors. These will likely be normal practices for a long time. Presently in Nashville, there is an outbreak in the Titans camp and at juvenile court. Nationally, there's an outbreak at the White House, and it continues in the Midwest. Globally, a surge continues in Europe. So while we have improved the borders of Nashville-Davidson County, the borders of the state of Tennessee, and even those of the United States, do not prevent others from bringing new opportunities for coronavirus exposure and infection from areas where COVID-19 may be rising and less well controlled. Although we've made much progress, we still have a higher number of new cases per 100,000 residents than desired. As Nashville opens more, we continue to practice all the safety habits that we've learned to remain healthy. This is expected to go on for months. To avoid a surge, we cannot completely let our guard down at this time. Remember to maintain physical distancing while continuing to communicate with each other. This may be difficult, especially when we see family and friends that we haven't seen in a long time because we want to hug. Remember that those with COVID-19 who are asymptomatic can spread the disease. Begin to consider the upcoming holidays. Determine if and or how you will gather with family and friends who are not part of your household, especially if you have visitors. Thanksgiving and Christmas will be different this year. Those of us in healthcare are very familiar with the surge in flu cases that we all see after the gatherings at Thanksgiving. It is important that we do not put our vulnerable family and friends at risk. Now, flu season is upon us. Hospitals and ICU capacities are usually stretched at this time of the year due to the flu. Now we have both COVID-19 and the flu. Both affect the respiratory tract. We will be susceptible to the two of them or both of them at the same time. This could be life-threatening. Discuss getting the flu shot with your doctor if you have questions about it. There is no vaccine or approved treatment for COVID-19 at this time. If you feel sick or you're exposed, Metro still has free testing for COVID-19 at Nissan Stadium, Meharry Medical College, and the old Kmart on Murfreesboro Road. And this is with new hours from 8 a.m. to 2 p.m. Remember, this is a public health issue and it affects all of us and requires that all of us take an active part in slowing the spread. That means that we avoid high-risk behaviors and practice safe ones. And just to remind us, the symptoms include fever or chills, cough, shortness of breath, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, or diarrhea. You can have one or all of them. The habits we practice to slow the spread are washing our hands frequently with soap and water or hand sanitizer that is at least 60% alcohol, no methanol, wearing masks or face coverings that cover our nose and our mouth, practicing social distancing of at least 6 feet, staying home if we have any symptoms, covering our coughs and sneezes, cleaning and disinfecting frequently touched surfaces. Continue to be in prayer with us for a speedy recovery, for strength and patience for caregivers, and comfort for the bereaved of all those affected by COVID-19. Remember, God's grace is sufficient, and His timing is perfect. We have to trust Him, despite the events that unfold. And you know why? Because it's God that holds tomorrow. By the way, the Health Ministry's 4th Saturday mini-series for October will highlight a discussion of breast cancer by our own Dr. Robin Williams. So join us, 10 a.m., Facebook Live, 4th Saturday in October. As always, be safe, be healthy, and stay prayed up. Have a blessed week.